live in 3, 2, 1, go.
Yeah, so I think we are live now. We'll give it a couple of seconds for everybody to join. How are you guys doing?
I'm
Good?
doing good, yes.
We're good. It's a nice morning. Though the sun is not there, but still.
Yeah. We have to pretend it's nice because it's like
Uh,
80% of the time, right?
Yeah, it's the Canadian weather, so
Yeah.
like we are used to it now.
Okay, so I think we can get started. So, welcome everyone to our Prep Nursing webinar. Thank you for joining. I am pleased to be joined by Akanksha Misra, who is the head instructor of Prep Nursing and NCLEX Prep course coordinator. Also a registered nurse in Joseph Brandt, right, in Burlington, Credit Valley, I believe, as well.
Yes.
And you hold, you have a hobby of collecting licenses in different countries. So I think India, US, and Canada, you have your license there. Also, Dr. Akshat Chaudhry, dentist by profession.
Good morning, everyone.
Thank you for joining us. And you have also some common grounds with nurses because...
Yes. So back home, we had our own nursing home, and I was the one who was looking after the operations of the nursing home, and was supporting my family in running that. So
Nice.
over a period of say 5 years, I've worked closely in close collaboration with the nurses, and I have literally seen like the kind of problems they come across on day-to-day basis, the kind of roles they play in day-to-day basis on providing the efficient healthcare delivery to our patients.
Nice.
And how important the nurses are to the health profession.
Nice. So, and I would like to introduce myself. My name is Dr. Marwan Al-Reis. I'm also a dentist by profession. I'm the Chief Learning Officer, I would say, of the PrEP series. So PrEP Doctors, PrEP Pharma, PrEP Nursing. So I overlook these different programs. And what you mentioned, actually, I observed different thing. I observed the deficiency in healthcare in Canada because we have a problem in Canada where, especially in hospitals, COVID actually exposed the extreme deficiency we have, and we are working to help actually cover some of this deficiency. And one of the main ones, and I think is, in my opinion, on the top of the list of the most crucial professions, is nursing.
Right.
So that's why we have launched the Prep Nursing. And today the purpose of the webinar is to actually talk about how can an internationally trained nurse acquire the license to practice in Canada. So welcome everyone, and I would like to welcome you to the webinar. So I would like actually to start with you, Akanksha. Can you give us a little bit about the application process? Because I also hear that it's not that easy. So I would like you to talk a little bit about the application process and what's the path to become licensed in Canada.
So right now I'm sitting here very comfortably, but I can tell you when I came to this country, I was all confused. Like literally had no idea where to start, and it took 2 years of mine. I was already licensed back home, was practicing as registered nurse, but what happened when I came here? Because of lack of guidance, I wasted 2 years. So it is always better to seek for guidance when I suggest when you're thinking you already want to practice as a nurse in these countries, especially in Canada, US and India, and Australia. I did not know that you can be sitting at your home country and can do all the process there.
Oh, okay.
And I wasn't even required to come to Canada in order to, pass my exam and begin my application process.
Okay.
So anyone, whosoever is sitting anywhere at their home countries, can, if they're planning to come to Canada or Australia or US, they can literally begin and start their process by sitting at their home countries and apply for it. So I will be talking about Canada first of all, and we'll be taking example of Ontario.
Okay.
Here, how it goes. The first step, if you want to get licensed as a nurse in Canada, the first step is to apply to NNAS. So NNAS is actually an organization which makes sure all of your documents are up to the point before they get submitted to the provincial bodies.
Okay.
So the downside of it is NNAS takes about 8 to 9 months.
Okay. So
If
bottleneck.
if one document goes wrong, maybe a couple of more months. And I've
Okay.
seen people waiting for the NNS applications to be approved for about 2 years.
Okay.
And they literally send the notice that, oh, your time is up because of lack of the guidance.
So there is a time limit as
Yes,
well.
Yes.
But this you can initiate from back home.
Yes.
You don't have to be here. You
Right.
submit the application, you start the process. But it's a lengthy process to get approved.
Right.
Okay.
And all the documents will be required. So NNS would require documents from your college directly to them. They will be requiring documents from your regulatory body back home directly to them. And then that report, they will deliver a report. So issued report will be submitted to the provincial body then.
So let me stop you there. So that's step number one.
Right.
So what I want to point out to people is, by the way, guidance is the most important step.
Very important.
Now, when I was actually listening to the process of getting licensed as a nurse in Canada, it's way more complicated than dentistry or other professions where you have the steps are clearer and still it takes more time.
Yes.
So the reason I'm saying this is step is usually very meticulous. You have to be very careful on satisfying the requirements, and that's where you have to seek guidance. So if anybody is interested in actually pursuing that step, so feel free to reach out. I'm just interrupting you so that you can guide them.
Yes.
You're available to guide people on the documents needed,
Right.
because as you mentioned, one mistake cost them a couple of more months of waiting.
Exactly. And when the report is issued and then submitted to the CNO, if I talk about Ontario, they do not consider they won't give you a license even if you have passed your exam, cleared your police clearance, jurisprudence exam, if you have not worked in past 3 years. So now we can relate, wasting the time there would affect you in this scenario that you are not able to practice because your evidence of practice is expired. It's like you have to keep on working for at least in past 3 years in order to get licensed.
Okay.
Or they would tell you to go back home or work here as in under different programs are out there. So they'll have to start working in those settings so that they know that you are actually still.
So while you're getting the
caught up
first
with
step through, you have to be practicing
Yes.
to make sure you
Yes.
are in.
Yeah, so indirectly, it's not a learning curve by itself, but it is a work and learning curve simultaneously. So,
Okay.
you cannot sit laid back and just study.
Okay.
You have to work according,
You have to.
on the sideways.
Yes.
Okay.
Yes.
All right.
And once that is done, CNO documents are approved, then the most important or crucial step is passing the exam.
Okay.
That takes 90% of the efforts after all the application process is done.
Okay.
Guidance is needed because everyone thinks, oh, we have.
So we talked about 2 applications. Sorry to interrupt you so
it's
far.
just one application, different steps of it.
Different steps. So it gets passed from one body to another?
Yes.
Okay, so the same applicant. Do you have to apply or do something to the second body, to the provincial?
Yes, yes.
Okay.
To CNO, if we
Yeah.
talk about College of Nurses Ontario, the documents will have to be submitted to them. And
Okay.
we have to start application process there again.
Again.
To tell them, oh, we have got our reports. Now you can look at it and let us know. Then they give the eligibility whether you are allowed to take your exam or not.
So,
What else is needed?
so the provincial body is looking at the experience.
Right.
The federal, or let's say national body, is not looking at the experience.
No, they do not.
So they issue the report, they send it to the provincial,
Mm-hmm.
then the provincial will say, okay, your report plus a new application plus experience,
Yes.
you're good to write the exam now.
Right. If,
Okay.
if someone have not worked, so why I'm specifically mentioning evidence of practice, if someone have wasted 2 years in NNS process, we can imagine they're not allowed to practice in Canada because they might be sitting in Canada and applying, and they have passed the 3-year period.
Okay. So start from outside.
Refreshers will be required for
Yeah,
that.
so start from outside is an advice.
Right.
Right? Yeah.
So it's
Okay.
like a good idea to start, get into your preparatory courses at the time when you are working. And I believe the kind of work environment that everybody has back in their home country, because they have the support from their family and relatives and they have everything accessible. So I guess it's more easy for them to work out the balance between the, work and the study plan.
The studying plan.
So it would be more convenient, I feel.
Okay.
But there are few provinces out there, if I talk about Alberta or Saskatchewan. So what they are doing right now, that process I explained, the NNS process, it takes about 8 months or so. $650 is the application fee approximately. They have waived it.
They have waived the fee.
Yes, waive the fee and the NNS process for certain nurses who have license in certain countries.
Okay.
For example, If there is a nurse who is licensed in India, Philippines, Nigeria, New Zealand, there are a list of more countries there. If they're already licensed in those countries, they do not have to go through NNAS. They can directly apply to the provincial body.
But only 2 provinces.
For now, there are 2 provinces.
Okay.
Yes, Saskatchewan and Alberta.
So that will save them the 6 to 9 months.
Right. And also the evidence of practice period, they call it, I think, currency of practice in Alberta. It's 5 years. They allow you, even if you have
so you have more
years,
time, you know,
Yes.
you have
Yeah.
more window, a bigger window out
A
there.
bigger window.
Yeah.
they're trying to make it easier so that more and more nurses can actually practice.
So how much time does that phase take? Like after the provincial phase?
So they have literally mentioned that once we receive the documents, we will be issuing your report in 5 days.
Wow.
Okay.
Oh,
That's
that's quick.
tremendously
That's
fast.
quick.
Yeah.
Yes. Right.
So if
Wonderful.
someone is actually satisfies the requirements from India, let's say,
Yes.
they decide to go to Alberta,
Yes.
they submit an application,
Right.
5 days they can write the NCLEX.
Yes. And they don't even have to come to Canada to write the exam, because I think most of
Okay.
the listeners might not be aware that they can do the exams at the centers available. So,
So
in
you
their
have
own country.
centers across the world?
Yes.
Yes.
Oh, it's like the prometric
Because it's
centers?
not only an exam for
Here's-
Canada, I believe, it's also for US as well, right? It's the
Right.
same exam.
It's the same exam for Australia, US,
For Australia,
and Canada.
US, and Canada. It's the
Oh,
same
so
exam.
are you saying that by applying to one provincial body, getting your documents approved, proving your eligibility to appear for exam, if
Right.
you appear for the exam, simultaneously you can have 3 options opening up for yourself?
Exactly.
That is
And
US,
those-
Canada,
yes.
and Australia.
Yes.
Wow.
And results can be transferred anywhere.
Okay,
Because-
so the 2 provinces you mentioned, Alberta and
Saskatchewan. Yes.
So that's a shortcut.
Yes.
That waived the first step. Ontario, you're gonna get stuck,
Right.
right? Okay, so to summarize, if you are coming to it's very easy to summarize is don't aim for Ontario, Alberta and
Yes,
Saskatchewan if
yes.
you're coming from outside.
Yes.
But let me ask you, once you get your license in Alberta and Saskatchewan, let's say then you want to move to Ontario, what happens?
2 weeks.
Okay.
Oh,
It
so
just
that's
takes 2 weeks to transfer your
that's a
license.
super
That's
expedited
like a bypass
process.
surgery, you
Yeah.
know?
It's a
Yeah.
bypass surgery. Yeah.
Okay. And I also, I remember when I was doing some search, there's also a bypass through the States,
Yes.
right? Would you like to talk a little bit about that?
Yes. So you might have heard, a lot of listeners might have heard about, some people are applying to Australia even if they're sitting in Canada, or they're applying to US. The thing is, US or Australia actually, they in the education they give you equivalency. So they do not tell you, you need a refresher's course, or you need to do OSCE, or you need to do anything else. They directly give the eligibility to write the exam if the documents are meeting the eligibility criteria.
So do they compare the program you went through with, like, do you have to go through universities there? Like you have to apply to a state
Yes.
to evaluate
Yes.
your...
So for US, it's CGFNS. They can directly apply to CGFNS and can apply to the state there. Or the second option is applying directly to the state.
Okay, so when they apply directly to the state will just verify the program, right?
Right.
And then the minute they say it's good to go, they can write the NCLEX.
Yes. Doesn't matter if they have, evidence of practice. They've been practicing for 3 years or not. They
They're
don't
done.
care. They give the
Okay,
license.
so they finish the NCLEX in the States. Can they come to Canada?
Yes.
Okay,
Exactly,
so that's
because
another...
that same exam is considered, and some candidates might have, there is a list of requirement. It always says outstanding. This is outstanding. Your language proficiency is outstanding. So and a funny thing came up. I remember one of the students I was actually talking with the application process, and it said outstanding, and they thought like they're outstanding in it. So sorry, it doesn't mean that. It means that's pending, and they'll have to fulfill that requirement.
Okay.
Outstanding doesn't mean that you're outstanding in it. And so what happens? Those requirements are fulfilled. It's
Okay.
easy. And even the education requirement is fulfilled if you're done NCLEX anywhere in the
Okay,
world.
so although the process may look a little bit complicated, but there are nice routes that
Yes.
people can actually go through.
Yes.
So this is actually the first section we want to talk about. It's how to apply, how to actually get in. So if anybody needs further information, feel free to reach out to Prep Nursing and we can help you out with the process. Now we got to the, is there more before we get to the NCLEX?
Something really important just came into my mind.
Yeah.
If you apply to Alberta Board, it costs about $500 something. They have cut down that fee to $50 for the nurses who belong to these countries.
Okay.
Oh, wow. So it's
They're
not only that
actually-
you pay a lesser amount, you also get your process
Expedited
eligibility,
process,
you know,
yes.
certificate in a shorter duration, and
Okay.
then like once you clear the exam, you can also move to any province of your choice,
Yes.
depending on like
Okay.
which you choose.
That's
and-
very important, by the way, because we want to solve the problem of every time we go to the ER, they make you stay
Yes.
for 24 hours waiting for your turn. And it's not only doctors, also nurses. Sometimes we find like there's 2 nurses running the whole ER department. So the second step is NCLEX, right? Moving from like once they get approved. But just to finalize one thing that just came to my mind, Alberta, Saskatchewan, that application, how difficult it is to prepare the documents for that application there,
With
for the provincial.
With the right guidance, it shouldn't take more than, I think, 2 days. You apply everywhere and then you just sit and wait.
Okay.
So each and every institution, your college or regulatory body from back home will be submitting documents directly to them. So candidate doesn't have to do anything in there. It's just
So this is very important to note, because if you're saying the 5-day processing, that means the preparation for the exam should start before, because
Yes.
they're not gonna have time after, like they're gonna get approved so quickly that they're gonna find themselves into the exam.
Yes.
Okay. So this will take us to the second part, which is now they can do the NCLEX, right?
Yes.
So I know that just talk a little bit about myself. You said that there's a pharmacology section in the NCLEX, so I have been invited to teach. So I'll be teaching that part of the NCLEX because I teach pharma for pretty much all of the other disciplines. And I took pharma, by the way, with nurses. That was my first pharma courses when I was in undergrad before getting to dentistry. I was doing biochemistry and biotechnology. That was my major. So there's the electives. I started to go into pharmacology. I liked it. So there was the only pharmacology offered at University of Windsor was in the nursing department. So I took a couple of courses
so you
there.
have also worked closely, like, you know, at the
Yeah.
grassroots level.
It's actually it's a nice pharmacology when it comes to nurses. Like when we went to dental school, we were taught by pharmacists. The type of pharmacology they teach you is way more in depth. So the nursing pharmacology focuses more on the application of the pharmacology than actually the basics, the in-depth basics behind it.
And just to mention, each and every nurse I have seen in my entire life always have problem with pharmacology.
Everybody has problems with
Everybody.
pharmacology.
It's actually very difficult.
So is it like the more you deal with the medicines, the more side effects you
Yeah.
start getting?
Yeah. It is. Dentists, they don't like pharmacology. Everybody, like pharmacology is a dry topic, but I have been teaching it for a while, so I always try to bring it from an understanding perspective. So after people take the pharmacology, especially dentists, they say, oh, we see it from a different perspective now. And I usually tie it with the physiology. Like the minute there is a link between physiology and pharmacology, things get easier. But that's one topic. Now, when we talk about the NCLEX exam, I want you to tell us more about the exam itself and the preparation, and then we'll talk about our courses
Right.
that we have established.
So NCLEX have recently been changed in 2023. They have changed the pattern. So now it's called Next Generation NCLEX exam, which is again the same exam for Canada, Australia, and the US. So in there will be 150 questions. They have added different kinds of case studies in there. The formatting has been changed. They've tried to make it more like real life scenario. So how nurses look at the charts, or they compare the laboratory reports, or look for the signs, symptoms, what's happening. They are making it more like nurses will have to think critically. And trust me, it's not about how much you know.
It's a judgment
yes,
exam. You
it's
can call it a judgment exam.
Yes, it's not about what's in. I have seen university toppers failing the NCLEX exam. It's not because they don't know. They have a very vast knowledge. They have very good command onto the content, but it's about knowing the tips and tricks on how to answer, on the strategies, how to answer the questions.
Usually, when we talk about judgment in the medical field, that's when you enter the gray zone, because basic science and theory is black and white. Like, how does amoxicillin work? We know how it works.
Yes.
But when it comes to the application, we have a gray zone. So navigating through the gray zones is not the same as knowing the background. So it's very important for people to actually know the standards and the expectation of the application of this knowledge in the Canadian healthcare system, US and Australia. We are pretty much aligned. So it is very important. So what type of courses are offered?
So at Prep Nursing, we are offering NCLEX prep course. There is RPN prep course, which is for the RPNs who are planning to get licensed in Ontario and BC. This exam is only for these two provinces for practical nurses. And if you are in any other province of Canada except Ontario and BC, it's CPNRE. That's the old format of the exam.
Okay, nice. So Dr. Akshat, I just want to ask you a couple of questions because usually in the prep series, let's call it, we have a methodology of delivering the courses.
Yes.
So what we want to talk about now is for the NCLEX preparatory course, let's talk a little bit about the features.
Yeah, so, seeing the dynamic nature of the exam and what Akanksha mentioned that, like it's more about the judgment and the clinical applicability of what you're studying. So we have designed and carefully crafted this course to suit in the best interest of our participants. So we have the course running for almost 10 plus weeks, out of which we would have lecture sessions, live lectures happening in the 8 plus weeks. And then we have 4 mock exams spanning across 2 weeks. So we have carefully, built up the question bank. Now in this altogether, if you look at the number of lectures, we are at 32 plus lectures, delivering over 95 plus live hours of session. To help the participant, prepare and to analyze their performance, we have something called as the LMS, that is the Learning Management System. So in LMS, the participants have the capability of, attending the weekly quizzes, practicing the quizzes, gradings, they can evaluate their grades, they can see their progress, how they have been progressing from test 1 to test 3 to test 7, like that. Then not only this, we also have introduced live Q&A sessions for every lecture. We would be doing that. Then, in order to help the participant get the enough practice for the exam, we have crafted around 4,000 plus questions on the LMS platform. This LMS platform is accessible online. They can do it at the convenience of their home. They can access it 24/7, 365 days a year. There is no cap limit that you can access it these many times. No, it's completely unlimited. And with those things in place, and with the kind of experience that Akanksha is bringing along with her, and with the the amount of the kind of leadership that we are under, from your experience as well, we are pretty confident that any participant who is associated with prep nursing would be having the required tools to ace the exam. And this is what we call as passing guarantee. So passing guarantee is not that if you join us you will pass. That's not the case. We have certain metrics in place. We have certain standards that every participant has to meet. Like, to quote a few, it's like 90% attendance. So make sure that the participant is attending 90% of the lectures.
Yeah.
Then we understand it's a learning curve. Not everybody gets everything from day one. So we have set a benchmark of around 70% passing. You have to score 70% or 75% in your exams, that is in your weekly quizzes, and 75% should be in 70% of the quizzes. So you have 30% of the room where you can fail miserably, and we are okay with that.
Okay.
Then before the participant is ready, going for the exam, we would evaluate these reports. We will give our final verdict, and then we can pretty much say that once these protocols are hit, or you check mark these points, you're pretty prepared for the exam.
You're good to go. Okay, so this is actually, I want to focus here on the trackability, the importance of trackability. What it means is, and this is a system that's applied across the board in all of our programs and courses that we offer, which is when someone signs up, it is important to actually follow up with this candidate step by step to make sure how they're progressing. They even get an alert when they're not progressing well, because we take their future very seriously. And we want to give them the right guidance and the recommendation. And I always say there is only one attempt. With prep nursing, there's one attempt. You just do it, you pass, you're done. You don't have to go through a negative experience. And how to achieve that? By achieving the metrics you mentioned, and by proving that you're passing before you actually go to the exam, in the mock exams that they do.
Yes.
But just to simplify things, Akanksha, let's say I signed up for the course today. Explain to me, what am I gonna be doing throughout, week by week? So I understand that there's lectures, right? So I'm gonna be attending lectures.
Right.
Okay.
So we do understand that there are chances that some candidates might have a long gap and they literally forgot everything. Even if a candidate comes in with, I have no idea what nursing is about, we are giving the comprehensive reviews. Everything will be covered. Whatever you need to know related to exam, which might be, a question in the exam, you will be guided, prepared for that. There will be practice sessions, weekly practice session in class, in which we will be talking about, this is how you do the question, these are the strategies, how you read the question, how you implement the strategies there and answer it.
So the lectures themselves will have a practice in them?
Yes.
Okay.
Yes.
So I will take a lecture, I will take with you a lecture, you'll explain a certain topic, then we solve practice together.
Yes.
Okay. So
in-class practice sessions,
okay,
along with the practice questions given for the candidates to do on their own
that's
pace.
homework.
Yes.
So after we take the topic on the LMS, there's going to be questions that will be unlocked.
And then there will be weekly tests as
Okay.
well on those topics.
So is there two different pools of questions?
Yes.
Okay,
Yes,
so
there
one
are.
pool is practice where they're not getting evaluated.
Right. And
This is
there's-
for them to actually know the topic more.
The
Yes.
self-evaluation.
Self-evaluation.
Yes.
And then they are evaluated and tracked by you, because you're the
Right.
course coordinator. So everybody who's in the course, when they start doing the tests, you're going to get the reports. So you know who's performing well, who's not performing well, and so forth.
Yes.
Right?
Yes.
Okay. And then you move to second topic, and this cycle repeats.
Yes.
Now-
Along
And
with that,
we also have another feature in LMS that, let's say, if a participant attends a quiz for self-evaluation, and for an example, if they performed 50%,
Yeah.
their performance was 50%. Now they go to the topic again, they revise the topic and come back. Now they have the ability of attempting it again, and now the score is 70%. So the LMS will notify them that how many attempts they have taken on that particular test, also what is the average score for all the attempts taken together, and what was the individual score, so they can, the participant can evaluate and see it clearly what was the point they began with and what is the point that they've reached now.
Yes, and also it gives them a comparison to the rest of the candidates, so they
Yes,
see
it
themselves in a
does.
pool, how they're performing in comparison to the rest
Yes,
of the
those
class.
reports are also given, that what was the class average, where you stood on that class average, and the LMS also has the capability of giving out reports where what was the performance of the overall batch for this particular question and what was your performance in relation to that.
Yeah, I think this is a lot of information. People tend to get confused, but I also want to talk about something important that we face across the board. Let's say I study different topics, right? Like I study physiology, biochemistry, pharmacology. At the end, when you study a broad topics, you feel confused. You're like, am I ready? Am I not? So you do the exam and then you score well. You feel good about it. But the LMS also allows us to even pinpoint the performance by topic. So even if you scored well, it will point out that, by the way, in pharmacology section, those questions in pharmacology, your performance was 50%. So you need to work on that. So it also works as a guidance to where to actually focus on in your preparation to make your score better. And also, with that, we have the one-on-one session. So you can talk about the one-on-one session feature of the course.
yes. So there will be one-on-one session with the instructors, in which further steps will be talked about. It will be talked about the student, where they are standing at, where are the problem areas, whether they're ready for the exam or not, what areas they need to focus on more, or how they can resolve that issue if they're facing any. Along with that, just to mention, we are talking about assessing it topic by topic. Why is that very important related to exam? There's certain competencies which are assessed in the exam. If a candidate is failing one competency, they fail the exam.
Okay.
So it cannot be like you are scoring very well in parenteral therapies and failing infection control.
Okay.
It won't work that way. You need to
All
pass.
collaborated
yes.
together.
Yeah. So even if they are doing 100% in the other
Yes.
competencies,
Exactly.
Okay,
If
it's
they
very-
fail
it's-
one, they're failing.
I think this is a standard of healthcare professions. They always have, like, you have to pass overall and pass per competency.
Right.
So that's very important. The software also allows for that.
Yes.
So overall, just to summarize the course, it's pretty much we're teaching the topics. We're giving you practice questions to actually tons of practice. We are tracking your performance. We are guiding you step by step, and we're giving you the recommendation and the go ahead. Now you are actually ready for the exam. so
And-
that they can
yes.
execute it from one attempt.
And before that, they have a chance to take a test run of the exam day. We are also offering the mock exams. So they will be taking mock exams, which will be CAT adaptive, and they will see how they perform
Okay.
on there.
So pretty much they're gonna live the exam before the
Yes.
exam. This is very important, by the way. Mock exams and living the environment of the exam before going is gonna make their life much easier during the
Yes.
actual exam.
Yeah, it certainly helps in dealing with the stress that every participant usually faces or comes across on the day of
Yeah.
exam. So when you can stimulate, stimulate the similar stress, you are more adapted to it, and your body would be better, in collaboration, in synchronization with that stress, and you have the ability to perform better.
Okay, so I want to register for this course. How can I register, and what's the total duration in preparation do you expect a candidate to be
So
ready?
the total duration is 8 weeks, 8 plus 2 weeks of mock, so total 10 weeks.
10 weeks.
And there will be classes, everything included, mock included. If anyone wants to register, directly go onto the website and you can register there. If you have any question related to anything,
If you don't
I
mind,
have
can you
confusion.
just mention the website?
Yes, it's prepnursing.com. You
Okay.
can go onto the Prep Nursing website. We will be sharing the links too. And if there's any question, they can just give us a call. Any question related to any application, any confusion, they want to be cleared up, they just give us a call and
Yes.
we are here to help.
Yeah, it's very easy actually. We're very accessible, and we can guide you through that. Akansha, is there anything else you want to mention for RNs, RPNs?
Yes. So the exam, RPN exam, is CPNRE. So it used to be the CPNRE exam for all the provinces. There used to be only 3 attempts.
Okay.
If someone have failed those 3 attempts and they still want to take RPN exam, now they can take REXPN because
Okay.
there is no limit to the exam now.
Okay.
So it has recently been changed, so they still have chance to revive their nursing career.
Okay. But we don't want. There's one attempt, as we said. Prep
Yes.
nursing. There's one attempt.
But that exam wasn't in place before. REXPN wasn't there in place
Okay.
before. It was just CPNRE for the whole Canada.
Okay.
And some people have already exhausted their 3 attempts. Now they're eligible.
Also,
to
they
take
have
exam.
another route
Yes.
to go through.
Say people who end up exhausting attempts now have a new chance of
yes.
reviving their career. Wow.
Yes.
Okay, that's good actually, and yeah, that works well with because there's a deficiency, so that
Right.
actually can utilize who's
Yes.
stuck in the system.
Yes.
In Canada. So that's great actually. So thank you very much for joining. I'm just gonna check. I think there's questions coming in. So see if there's any questions. So I think this question was answered, but I'll repeat it. It's can I do the NCLEX in Brazil?
Yes.
And or can I do it online? So the NCLEX, it's done. Can they do it from home, or they have to go to a center?
They'll have to go to a Pearson View Center
Pearson
to take
View.
the exam.
Okay.
Yes.
So it's because pharmacy they can do it from home.
Yes. And
Yeah.
one
Oh,
thing to
yeah.
mention, our course is entirely online. So no matter which part of the world candidates are sitting, they can just join in, and then we can help them with their journey to become a licensed nurse.
Okay, that's great. And this is another question. I am a nurse in Philippines, but I want to practice here. Okay, I think here is okay. There is a comment in Manitoba.
Okay.
So the question, I believe, it's about the province of Manitoba. So how, is there a way to do it here in Manitoba? So I believe it's
For sure.
the reroute, right? Like
Yes.
go next door,
Yes.
get it done, and then go
documents
back to
evaluated,
Manitoba.
Right.
Get your
Yeah.
exam done, and
And you can reach us if you need more information about Manitoba. It says this question: do you have any plan for NCLEX exam? I finished all process and I want to now take the exam. So I think
Our course is starting on 7th
yeah,
of
I
March.
think this was before we talked about the course.
Okay.
It looks like it, but you can
Yes.
go
So our
again.
course is starting on 7th of March. It will be entirely online. So you still have time. Make up your mind and get ready. You just need your 2 months and we will make you registered nurses.
Okay, great. And the question here is, I'm a nurse from Philippines. Do I still need to take the course? So I think the only thing is Philippines is a country that they can go to Alberta, Saskatchewan.
But NCLEX is
But
still,
NCLEX is still a must for
Yes.
any nurse that's gonna practice in Canada, US, Australia.
Yes.
NCLEX is a must. They have to
just
pass
to give
the
an
exam.
example, if let's say there's a nurse in anywhere in the world, if they have experience of, doesn't matter, 40 years, 30 years, 20 years, whenever they come to any of these countries, they have to start the process like this, what's being talked about from
Okay.
NNAS, and yes, to take the exam.
I think this question is, we need to clarify this because it says, I already have my NNAS report and I wanted to apply to CNO, but I did not get the eligibility, so I applied for Alberta. I just want to know if my NNAS report is okay to apply. They don't need it for
They don't
Alberta.
need it now.
Yeah, you don't need the NNAS report for Alberta. You can apply directly.
Yes.
Okay, and the last one is, yeah, the course is online. There's a question. So the course is online,
Yes,
fully
it's
online.
Fully online.
Yeah, and the features, the schedules, all of that is on the website.
Everything is on the website.
So you can
Yes.
go check it out, and even the registration link is on the website.
Yes.
Do you have 2-month course only? NCLEX question and strategy for reading question. So in terms of the NCLEX course is comprehensive, and what does it mean? We don't believe in having a course just questions. The course includes teaching the material, that's lectures, practicing questions during the lecture to show you how to apply the knowledge. Then there are questions you solve and we discuss them, and throughout you get the strategy how to actually analyze and do the questions. So the question here is, do you have a course for question and strategy, only for question and strategy? No, it's not only. We do have questions, we do have a strategy implementation and material teaching in the same period of time. When you're talking about 2 months, actually instead of 8 weeks, it's 10 weeks because we have 2 weeks at the end of mock exams. Yeah. So I believe this is, oh no, there's one more coming. Any info about to become an RN in Ontario as an international one? We did talk, I think, about
Yes.
RN in Ontario.
Just give us, if there's still questions, reach out to us at info@prepnursing.com or give us a call. We'll
Yeah,
be able
I
to
think
answer all of your questions.
you guys can reach us through email. So if you can list the means, there's by phone, by email. There's a WhatsApp number that is available for nursing.
Right.
I think that's the means that everybody loves to utilize.
WhatsApp is it's quite
Okay, so if you guys can just list the number so people can utilize it to reach out for any inquiries.
Yes. That'll be posted in the link there.
One more coming to verify your registration for India. So they either ask for PNRC or NNAS. So I gave my NNAS. Okay, so it's getting into specifics, I believe.
Yes,
Isn't
so PNRC is the regulatory board. So you'll have to submit documents from PNRC to NNAS, and then they will give the report. This is the regulatory body for Punjab.
I guess more apt way of answering this would be if they have any specifics in concern,
Right.
they can send us an email and we can provide
Exactly. I think that's-
algorithm kind of thing, like a flowchart type kind of thing that it simplifies the process.
It's
for
much
them.
easier. We'll do it one-on-one. It's customized actually. So the number is posted and the email is posted in the chat section. So what we would recommend is, we talked about the overall process, but if there's any specific concerns, feel free to reach us. Features of the course, the timing of the course is on the website. You can visit the website, or even if you want to inquire more about the course, if anything we did not make it clear, feel free to reach. We wish everybody the best of luck, and I would like to thank you for joining us.
Yep. Thank you so much,
Today,
Dr. Marwan.
thank you very much,
And
everyone.
to all the participants at Prep Nursing, we are not only here to help, we are always happy to help as well.
Yeah, and we look forward to seeing you in the course.
in the course.
I want to see how good they are in pharma.
Yeah.
So, okay.
I would be testing on the basic sciences.
So thank you, everyone. Looking forward to seeing you in the course.
Thank you.
Thank
Have
you.
a
Thank
nice
you.
day.